Last week, you mentioned that UChicago has over 100 ventilators available, but is only using about half of them at a time. That's really great to hear. Is the situation at UChicago reflective of the rest of the city? Does this mean that the peak of the pandemic is over?
That's a good question. Overall, we're still in the plateau stage, so meaning we're at high levels of rates of new infections, but we're not quite coming down yet. I know I mentioned that our numbers at the hospital came down a little bit from the peak, but there are other hospitals also with slightly increasing numbers too. So our hospital is reflective of the general situation in that there's capacity in Illinois and in Chicago to handle more cases. But again, we're still at a plateau stage. So we're still seeing a large number of infections coming our way. But that being said, we've done a great job overall here in Chicago and Illinois just to in suppressing the curve, suppressing the number of new infections by social distancing. Um, and so we haven't seen the really high peaks and surges in the hospitals that we were planning for. So there are plans right now to dismantle McCormick Place, which was originally planned for 3,000 additional beds. And that's just because very, very few people have been treated there. And by suppressing the curve, we haven't needed that facility.